Good morning, and good afternoon, and good evening to our online audience. It's my pleasure to welcome you to today's webinar, From Recommendations to Collective Action for Children's Development, Care and Protection. I'm sure there are a couple of people still joining, but as they join, we will get started. I'm representing the Inspire Working Group today, and I am thrilled to be co-convening this webinar alongside the Alliance for Child Protection and Humanitarian Action, the Better Care Network, Early Childhood Development Action Network, the Moving Minds Alliance, and the Georgetown University's Collaborative on Global Children's Issues. I'm Jody van der Heide, and I will be doing the opening remarks. I am the Inspire Working Group Coordinator based at the Institute for Security Studies in South Africa. The Inspire Working Group is a global multi-sectoral collective that supports the dissemination, uptake, and implementation of the Inspire package, that is Inspire 7 Strategies for Ending Violence Against Children. The primary goal of the Inspire Working Group is to advance the uptake and scale up of evidence-based interventions to prevent and respond to violence against children. And the working group acts as a harmonizing force and aligns the efforts of member organizations to achieve collective impact. Next slide, please. So as we are waiting for the last couple of audience members to join, just a little bit of housekeeping. We would really love to know who's in the room with us today. So please introduce yourself in the chat with your name, your organization, and where you are joining from. We would love to know who you are. And when you send your message in the chat, make sure you select everyone in the chat function. Please note that we do have French and Spanish interpretation available. So if you navigate to the bottom of your Zoom screen and you click more, there should be a little interpretation globe for you to select an option. Throughout today's event, we are really interested in hearing your thoughts, your questions, or your comments. We would like to keep it as interactive as possible. So please feel free to use the Q&A function in the chat. If you navigate to the bottom of your Zoom screen, you will see a Q&A function. Please pop your questions in there, and that way we'll be able to see your questions directly. Next slide, please. So again, here is how to navigate to the French or Spanish interpretation if you need it. Just navigate to the globe function on the Zoom screen, and you should be able to select and automatically hear the interpretation that way. Next slide, please. So just to give you a flavor of today's event, after my opening remarks, we will do some welcome remarks, and then we will have a short presentation on the findings from Georgetown University's Collaborative on Global Children's Issues. This is the 2 reports that are the basis for today's webinar, and after that, we will move into an expert panel to discuss some of these recommendations. And after that, we will move into Q&A to hear your thoughts. We will also have an interactive element as well, and then we will close. So with that, I would like to hand over to Gillian and Hani for welcoming remarks. Sorry. Thank you so much.
Thank you, Jody, and so good to see everybody today. Thank you for joining us for this conversation. My name is Gillian Hubner, and I lead the Collaborative on Global Children's Issues at Georgetown University in Washington, D.C. And we founded the collaborative in 2021 to foster cross-disciplinary research and dialogue on critical and emerging global children's issues with a particular focus on children in adversity. And at the time, in 2021, we of course didn't foresee that the global foreign assistance landscape would be upended a few years later. So the closure of U.S. aid in early 2025 marked a dramatic reduction in U.S. government foreign assistance programs reaching children. And the impact has been staggering, as so many of you on this call have certainly felt the direct effects. But as we have also all witnessed, the dissolution of U.S. aid and the disruption of critical sources of funding do not cancel our capacity to care and to create. So in response to these challenges, adaptation is necessary and of course already underway. I would like to thank the GHR Foundation and an anonymous donor for their immediate and flexible support to this crisis. Through a gift from the foundation, we were able to bring most of USAID's brilliant Children in Adversity team from USAID to Georgetown. They allowed us to preserve the brain trust and secure many of the documents that disappeared overnight. This team has moved forward to document the milestones in the evolution of the US government's work to support the development, care, and protection of children globally over many decades, as well as the coordination efforts across the US government that promoted a holistic response to the needs of vulnerable children. This team has consulted with over 200 stakeholders, including technical experts, civil society staff, and people with lived experience. They've provided a wealth of strategies and possible solutions tailored to the current political and funding environment. We are grateful to all of the networks that have helped to facilitate these consultations. It has been a truly collaborative effort, and it's extraordinary to once again see the global community stand together. I'm going to turn over now to one of our network leaders, Hani Mansourian, the director of the Alliance for Child Protection and Humanitarian Action. Thanks for being with us, Hani.
Great. Thank you very much, Gillian. I hope you hear me okay. Welcome, everyone. I have had the privilege and the honor to have been part of this journey that Gillian just described from the early days of when the Children in Adversity group and the Brain Trust, as Gillian mentioned it or titled it, moved to the collaborative. And I must say the part that has been the most impressive is the resilience and the dedication of this group, that immediately after they were hit by what one would consider probably the most significant professional blow that one could get hit by, when 10, 20 years of your work is basically being disappeared overnight. They turned all of that into a positive kind of forward-looking strength and energy to really invest in documentation, but also to really thinking and being a partner to all of us, the rest of the architecture, to really think about what this means for children affected by adversity and how we can all come back together and make sure that this does not turn into an earthquake that destroys everything for our sector. So really a huge kudos to all of you guys. I won't name names. You all know who you are. And a huge thank you to Georgetown's Collaborative on Global Children's Issues for providing the platform for this initiative. And as Gillian mentioned, the funders behind it. Now I'll move on to a bit of a more depressing part of what I was going to say. Of course, we know that we are at a moment of profound strain for humanitarian and development systems, but particularly for children and young people who are exposed to adversity. A recent evidence generation work that we did within the Alliance, a global analysis of the impact of the funding cuts. And as many of you would know, US government actually has been systematically before 2025 the largest donor for child protection across humanitarian settings. This analysis showed us that we have what started in 2025 as a financial disruption has evolved into a systematic deterioration of child protection systems, with rising risks, shrinking services, and weakening of frontline capacity. Across context, and we had, I believe, over 70 contexts reporting against this data, we are seeing reductions in core services such as case management and psychosocial support, increased pressure on an already overstretched workforce. And in some settings, programs are being suspended altogether, leaving children exposed to harm overnight. This is quite simply a crisis within a crisis, because all these children were already dealing with crisis, and we almost imposed another crisis on top of that for them. In this context, it's essential that we recenter children, young people, and their families in our collective response, not as an afterthought, but as a core priority across humanitarian and development efforts. Their protection, well-being, and agency must remain at the heart of our decision, even and especially in the times of constrained resources. Now, I'll mention a few items that actually came out of the work that we have done on the impact of the cuts, but also has come out of the work of the collaborative, and they actually kind of overlap and match. One is the element of collective action and greater synergies across humanitarian and development actors, recognizing that resilient child protection systems must operate across the nexus. The second element is the synergies across sectors, ensuring that child protection is integrated in all aspects of humanitarian action as rightly framed by OCHA's centrality of protection policy, which unfortunately we see a bit of sidelining that is happening at the moment, but that policy is still there and effective. And across global and regional actors. I want to remind ourselves, and myself first as someone that sits at the global level, that we are there to support the frontline actors of those who are protecting children. And if our silos and architecture is confusing and distracting those that are in the front lines, we might be doing something different. Today's discussion will help us reflect on the challenges and importantly on the pathway forward. It is therefore a great pleasure to introduce Rebecca and Matito from Georgetown University, who will provide an overview of the historical context and key recommendations emerging from their work. Their analysis offers an important lens to understand how we arrive at this moment and how we might collectively navigate what comes next. Thank you, and over to you, Rebecca and Matito.
Thank you so much, Hani. Wonderful to be here with everybody today. If we can go ahead to the next slides. And next slide as well. But for those who don't know me, I'm Rebecca Levy. I'm the Associate Director at the Collaborative on Global Children's Issues and was formerly the U.S. Government Special Advisor for Children and Adversity at USAID. So just very briefly to expand on some of the background that Gillian provided. When we came over from the remnants of USAID to Georgetown, we had a couple of main project objectives. As everyone knows, when USAID was dismantled, it wasn't just that projects were terminated, but truly we lost everything. So tools, strategies, reports, evaluations. And a big early goal was just to ensure that we could capture as much of the learning and tools and resources that could still be valuable to the field. So we have launched the Children and Youth Knowledge Hub with nearly 300 resources now that were generated by U.S. taxpayer funds, and they remain available. It's very easily searchable, and we continue to update that. So if you do have documents, you can contact us and we'll add them. And then we also did this documentation effort in the historical report, A Legacy of Care, and I'll touch on that in more detail in just a minute. And then in addition, we were really focused on convening diverse stakeholders to better understand the impact of what was happening, and particularly to think about how we can come together to strengthen local leadership at this moment. So we've been in conversation with many of you joining today over many months, and we're really grateful for that, and grateful for your contributions to help inform this conversation. And then lastly, we are also ensuring that we're really intentionally engaging young people so that we're informed by their lived experience, of course, but also so that we're thinking about using our platform in a university setting with students all around us to build the future champions that we need to sustain this work for children. Next slide. So the reports are really robust, and we definitely will not be able to cover everything in them. So encourage those who are interested to download and share. They're both available here. And again, we won't be able to cover everything, but I will share a few highlights and context from the historical report, and then pass it on to Matito to give an overview of the recommendations to set the stage for the conversation and panelists today. Next slide. So top line, we did in the historical report just want to sort of remind everybody that U.S. foreign assistance has contributed to really remarkable results for children. If you look at over the past 50 years. And there are many, many flaws in the system, some of which we'll unpack more today. But with focus and on so much about what's wrong with the system, I think just reminding ourselves that there has been really transformational change for children, and foreign assistance played a significant role in that, including things like a 61% decline in under 5 child mortality, 5.5 million babies born HIV-free, et cetera. But the report itself was really focused on the evolution of development care and protection for children. And we know that care and protection services are often sidelines or marginalized, that health and education sectors tend to be the focus of governments and donors. So this care and protection is really quite often a missing third leg of a three-legged stool that's needed to support children. And in many ways within the US government, the story particularly starts with the launch of the Displaced Children and Orphans Fund in 1989. And I think one important lesson when you go back and look at all of that history is that impact is not always correlated to dollar amount, and you can do a lot with a small amount of money. And I think the DCOF story illustrates that, because DCOF really had an outsized influence, I would say, on the trajectory of foreign assistance for children. When you look at some of the seminal research and evidence, like the Children on the Brink series, when you look at some of the organizations that were seeded by DCOF, including some that are here today, like BCN, and when you look at the role that this small fund and this small team of experts played in substantially influencing the development of the PEPFAR OVC portfolio and the development of the US government's child protection work in humanitarian settings, both of which became much larger sources of funding for care and protection of children. I think that's a little bit of a hopeful lesson that we can take away when we go back into the history. Next slide. And then, when you look at some of these lessons that we've pulled out, I think hopefully they will seem very familiar. They're really reflective of the objectives and principles that were found across 3 different US government children and diversity strategies. But the point is really that the work is not done. And so while the US government does not currently have a strategy in place to advance the development, care, and protection of vulnerable children globally, these lessons really can and should still guide other stakeholders. They're still just as relevant today. And the report goes into a lot of detail about the research and evidence and the project-funded work behind these lessons, and how they evolved across time. So you can definitely get the deep dive. But I just wanted to highlight 2 additional historical sort of themes that might be informative. One was that when you look at the arc over time, getting senior leaders to allocate budget and attention to development, care, and protection services for children was always very hard won. So time and time again, from the humanitarian disasters in the 1980s that really seeded DCOF, to HIV/AIDS orphan crisis, to the Haiti earthquake, all of these crises where we saw huge spikes in vulnerability and huge gaps in supporting care and protection, we always had to be making the case over and over again. And I think we will for a long time. So we need to make sure that we're still putting that case forward, even if this group is familiar with the evidence and the solutions. And the other thing is that when you look at some of the really significant milestones in terms of US government support for development, care, and protection of children, it was almost always the result of very strong advocacy pushing the government from the outside, as well as data, sometimes new data, highlighting the scale and the scope of the problems, combined with technical expertise and leadership within the government. And I have a feeling that that combination is probably also needed in other contexts. So, again, there's numerous times over the course of history where you can see those sort of elements coming together to create change. So I'll leave it there and I'll turn it over to Matito.
Hello, everybody. It is really wonderful to see so many familiar names on this, and such a great reach from globally around the world. So I'm going to go through this very quickly. It's going to be overwhelming, so please brace yourselves. You're going to get a lot of information in a short period of time. For those of you who don't know me, my name is Matito Watson. I am a senior fellow at Georgetown. I was formerly part of the Children and Diversity team at USAID. And when we saw the collapse of the foreign assistance for vulnerable children, we really wanted to come together and say, where can we go from here? So our process was to start last year, right when USAID was being dissolved. And we wanted to do a very consultative approach. So we reached out to what we saw as stakeholders within this area that we've worked with throughout the years, both in terms of the high level and globally, but really digging down at that local level, and wanted to see what the immediate impacts are and what people saw as ability to pivot and move forward in such a really horrific funding environment. From there, we structured several focus groups, especially local CSOs, individuals with disabilities, youth, and people with lived experience, to really get a flavor and context on how the funding cuts had really impacted their lives and their work. And then from that, we came up with a series of recommendations. It was a very challenging process because this is really affecting across all the work that we're doing on the ground for children. What we were hearing a widening equity gap unfolding in front of our eyes very, very quickly. Humongous loss of institutional memory and technical depth, and then an erosion of evidence and accountability from the local level all the way up to the very, very high level. So we organized this information into 4 pillars of recommendations. The first one was really reimagining aid infrastructure. What do we need to change? How we're working to really be successful moving forward? How do we really get behind governments so that they are taking care of the children, vulnerable children within their countries? How do we support them, encourage them? How do we really support those local, regional, and global networks as we see now as that connective tissue, that strength that's going to move forward in lack of a lot of the funding and the technical expertise? And then how do we maximize the funding through efficiencies and mobilizing new resources? Who can we reach out to? So under each of those, when we're thinking about reimagining aid infrastructure, we want to see a shift of power and resources to local actors. They have the expertise, they know what's going on the ground, and they're dedicated to really supporting their communities. We want to balance the immediate humanitarian needs with long-term investments. There's always been a little bit of struggle on that arc between humanitarian and development. And we want to make sure we are engaging the right people in these discussions from the beginning. So really, looking at it about nothing about us without us. Under the second pillar, we want to think about how do we strengthen and empower governments and their systems. So we want to strengthen local, inclusive, and multi-sectoral systems supporting children and their families. So that's not just social work, social protection, education, health, justice, finance, etc. How do we empower and resource local civil society and lived experience organizations to make sure that they are holding their governments accountable to address the needs of vulnerable children, no matter who they are? And then we want to, of course, invest in the frontline social service workforce, a little bit what Hani was talking about earlier. Under the third pillar, we really think that to move forward, we've got to work through these local and regional and global networks. That is going to be the mechanism to really align coordination and that evidence exchange. We don't want to lose that. A lot of organizations had to lay off staff, and I think we'll become more and more reliant on these networks to move forward. Finally, all of you know we cannot work without the funding and the money. So really under pillar D is how do we maximize these resources? And we heard some really good stories about improving efficiencies, sharing resources, improved collaboration. How do we look at new donors? How do we bring in unique ways of funding things? And then how do we increase domestic financing? So I know that was a lot. It was very, very super quick, but that kind of sets the stage for where we are. So we started last year. We now have the recommendations as launched. We are now looking on collective impact. So how do we really come together to do that collective impact? So I'm going to turn the floor over to Florence, who's going to talk a little bit on some examples of how we're seeing some of that, and then we'll get into a question and answer on how to move forward. So it is my great pleasure to introduce the amazing Florence Martin from Better Care Network. Florence, over to you.
Thank you, Matito, and thank you for doing such a great job under such pressure at time. I'm going to start quickly by introducing myself. I'm Florence Martin, the Executive Director of Better Care Network. And for those who don't know BCN. We're a global network that facilitates knowledge exchange and collaboration among the ever-growing number of governments, organizations, community groups, and individuals, including children and young people with lived experience who work to strengthen children's care around the world. And we also act as convener of the Transforming Children's Care Global Collaborative, which brings together this wide community of actors to strengthen children's care and care system. Now, to the business at hand, it's my incredible pleasure to introduce today an amazing panel of experts who are going to provide very concrete example of how some of the recommendations we've just heard about are put into action in different regions across both humanitarian and development contexts, and also at national, regional, and global level. We have quite a packed agenda and running out of time. So I'm going to do a very brief introduction of these amazing speakers, but we will share the links to their bios, and we encourage you to check those and also the links to their organizations that are doing incredible work. So without further ado, it's my real pleasure to introduce Carlos del Castillo Cabrales, who is the director of Bases Solidas in Colombia, and who is leading efforts through a national working group to integrate an ECD in crisis approach within humanitarian response planning, and by strengthening multi-sectoral collaboration and domestic financing streams. Carlos, over to you.
Thank you very much. Can you hear me well?
Yes.
Perfect. Okay, good morning and afternoon to everyone. Thank you to the organizers for the invitation. I'm very honored to share Colombia's ECD and Emergencies Working Group experience and to join this distinguished panel. So this short presentation today shares the ECD and Emergencies Working Group conceptual framework, and building on that, I will reflect on some lessons learned, challenges, and future actions for multisectoral coordination and collaboration, the integration of a crisis-based approach into Colombia's ECD policy, and financing in crisis context. So let's start. Next, please. So the figure on the left illustrates the nurturing care framework as a roadmap that ensures that all children not only survive, but also thrive and follow positive developmental trajectories. However, in the Colombian context, these development conditions are threatened for millions of young children due to the ongoing armed conflict in the country, disasters and events resulting from climate change, and cross-border migration. These three situations overlap and exacerbate one another, creating a prolonged multidimensional humanitarian crisis. The figure on the right contrasts two trajectories for children. Children who receive nurturing care are more likely to access specialized support during crisis, resulting in less severe impacts and faster recovery. In contrast, children without such care and support face more severe long-term consequences, reinforces inequality and intergenerational poverty. Ensuring timely, high-quality care for these children requires coordinated action across risk assessment, prevention and mitigation, humanitarian response, and stabilization. And to achieve this, in the Colombian context, four systems must be aligned under the umbrella of the early childhood education policy. The early childhood policy, the child protection system, which leads this policy, the system for the assistance and comprehensive reparation of victims of the armed conflict, the disaster risk management system, and the humanitarian architecture. And for the working group, this framework is implemented through these three strategic actions, which I will outline next. Next, please. So in late 2020, UNICEF and Sesame Workshop began co-leading the ECD and Emergencies Working Group, which was later joined by the Corporación Infancia y Desarrollo, which is a local organization. The working group advocates for nurturing care in all humanitarian crises and operates between two key humanitarian architectures, the OCHA-led country humanitarian team for conflict and disaster response, and the GIFM led by UNHCR and IOM for migration-related crises. And given its holistic approach, the working group coordinates with key humanitarian clusters and government agencies within the Intersectorial Commission for Early Childhood Development. Since 2026, the Moving Minds Alliance has expressed its interest in supporting the group's continuity and strengthening. So we have learned that the working group multisectoral approach has effectively placed children rather than sectors at the center of advocacy efforts while enabling collaboration and knowledge exchange across government and partner organizations. One of the most important challenges we face today is that, as a result of the humanitarian results, the working group governance must adapt while maintaining its primary objective, advocating for higher quality financing for young children in crisis. To move forward, the support from MMA will help strengthening the working group governance and impact by adopting a more local approach through the inclusion of local-led organizations and refugee-led organizations. Next, please. So at the 2023 Global Refugee Forum, the working group submitted a multi-sectoral pledge to support young children and caregivers in crisis contexts. And this pledge fostered the systemic integration of a crisis-based approach into the ECD policy and an ECD approach into the humanitarian response system, while strengthening coordination between these two systems to support children and caregivers in crisis contexts. As a result of this process, 31 indicators were defined to assess the government's capacity to implement the pledge, along with a policy brief and infographics to highlight the impact of crisis on children and caregivers and to inform evidence-based plans. We have learned that adopting a participatory and holistic approach with the government agencies fosters a sense of ownership and also paves the way for collaboration to strengthen the system's capacity. The challenge we face today is that reaching agreements with governments takes time, and also it takes political will to ensure these agreements are properly funded and to mobilize cooperation resources to support their implementation. And to move forward, we are looking to work hand in hand with the government and sectors to ensure the inclusion of these indicators targets into the upcoming national development plans or sectoral plans. And in addition, it is also critical to continue generating more data and evidence to strengthen outreach mechanisms with the government and donors to mobilize greater investments. And to mobilize investments for children in emergencies, MMA supported a study on local funding for ECD in crisis context in Colombia. And this study offers key findings and recommendations, of which I will highlight the following. In regards to the conclusions, first, despite increased public investment, underfunding and fragmented financing continue to constrain the delivery of equitable, high-quality, and integrated early childhood services, particularly in high-risk crisis-affected territories. Second, territorial inequities remain a core constraint, limiting their ability to ensure adequate funding for contingency plans related to armed conflict and disaster risk management plans. And third, non-government actors play a complementary but uneven role. This means that private and philanthropic actors contribute most to non-public funding, especially in early education, while multilateral agencies and international agencies, NGOs, align more with humanitarian actions, though early childhood is no longer a priority. And this misalignment hinders the strengthening of humanitarian development peace nexus. And in regard to the recommendations, first, we need to move forward in consolidate resources under a multi-sectorial framework and action plan that enables a coordinated, scalable, and crisis response actions. Second, we need to direct financing and capacity building to the most vulnerable territories and local actors to ensure effective response to conflict and climate risk. Third, it is critical to be able to track investments, align donor priorities, and deploy innovative mechanisms such as results-based instruments, pool funds, and blended finance to maximize impact and to strengthen the humanitarian development peace nexus. And finally, and very important, to keep advocating for the inclusion of dedicated funding investment priorities for ECD in crisis within the next National Development Plan. And that concludes my presentation. Thank you very much.
Thank you, Carlos, for this great presentation. And it also provided a very clear example of what balancing immediate humanitarian needs with long-term investment in strengthening systems can look like in practice at country level. So thank you for that. My next speaker, we're going to be staying with the approach at national level, but we're going to transition as well to more of a development context with South Africa. It's my real honor to introduce Opolang Selebalo, who is head of policy and advocacy at Smart Start in South Africa, a social enterprise focused on increasing access to quality early learning programs by strengthening the ecosystem with government, private sector, civil society, and non-traditional stakeholders. Opolang, Over to you.
Thank you so much. Thank you for having me, and to the conveners for pulling this community together around the launch of Where Do We Go From Here to Support Children in Adversity. What I want to share today speaks most specifically to reimagining aid infrastructure, empowering governments through multi-sectoral systems, and maximizing funding through domestic financing. But before I get into what these recommendations look like in practice in the South African context, I would like to start by explaining how ECCE is seen. Early childhood care and education is one of the most important phases in a child's life. There is broad recognition of this, and yet the connection between what happens in those early years and everything that follows remains unclear or unseen by those who control budgets and policy. And so ECCE remains underappreciated in its full breadth and chronically underinvested in. It is within this context that Smart Starts operates. I would like us to still stay on the slide, please. So Smart Start is a national early learning delivery platform comprised of 12 implementing partners, local organizations embedded in their communities. We support around 15,000 women to run home and community-based early learning programs, reaching 165,000 children weekly across all 9 provinces in South Africa. But we aren't only a delivery platform, we are an ecosystem enabler. Sustainable change in ECCE doesn't happen through a single organization, no matter how effective its model. It requires influencing the entire ecosystem, government policy, public funding, cross-sector partnerships, and how society values children's learning. So Smart Start's approach has been to work simultaneously inside and outside the system as an implementer, yes, but also partnering with government to shape the policy architecture, the regulatory environment, and the public investment needed for universal access. Next slide, please. But to understand why this matters, it's important to be honest about the barriers that exist. These aren't isolated, but sit across the system. Funding in South Africa doesn't cover the real cost of provision. Government funds early learning through the ECD subsidy, which is public money paid to registered programs to each child they serve. It's a critical mechanism, but it doesn't reach all programs. And even for those it does reach, it doesn't cover the full cost of running a quality program. To access this funding, programs must be formally registered, a process with requirements that many, particularly those in underserved communities, struggle to meet. ECCE is also not fully engaged across parts of government that have a stake in it. When it's seen only as a child development issue, departments responsible for labor, for enterprise, women's participation disengage, and with them, the funding and the mandates that they carry. And the workforce, mostly women, is not supported to sustain itself. So practitioners contribute their labor, their homes, their skills, and sometimes food from their own kitchens without viable livelihood support. So unless these are addressed together, access will remain constrained. Next slide, please. But for the purposes of our discussion, let me hone in on the financing element. So philanthropic funding has played an important role in the ECCE landscape, but it shifts with priorities, ends with grant cycles, and can't on its own sustain universal access. The direction we're working toward is government as payer at scale. As I said, in South Africa, the primary route to government funding is the ECD subsidy. And even for programs that access it, the per child funding doesn't cover the full cost of quality provision. And that financing gap is real and persistent, which is why we've been asking a different question. Not just how we get more from the education budget, but which government departments have a stake in early learning and how do we make that case to them? Early learning creates jobs, mostly for women. Home-based programs are micro-social enterprises. Practitioners are a workforce. So funding needs to see the full life cycle of a program. Getting started, navigating complex compliance requirements, accruing skills, maintaining quality, having coaching. None of that is covered by a single funding mechanism, which is why we're looking across government, the Departments of Employment and Labor, Small Business Development, Higher Education, and women all have a stake in the different parts of that life cycle. And we're actively exploring what practitioner stipends, enterprise development support, and still skills funding could unlock. So the ground is fertile for this work in South Africa. Over the last few years, we have seen real shifts in the system that make this particular work very possible. Next slide, please. So this slide speaks for itself, but let me briefly name what's there. The mass registration drive is an initiative by the Department of Basic Education, the national department in South Africa, and is bringing more programs into the regulatory net. A landmark 10 billion rand increase to the ECD subsidy after years of advocacy is enabling hundreds of thousands of more children to be reached. The Children's Amendment Bill is making its way to Parliament, proposing a more enabling regulatory environment. And the EOF, or the Education Outcomes Fund, a new blended financing mechanism, is designed to support both new access and quality in existing programs. None of this happened in isolation. It is a result of sustained collaboration between government and ecosystem partners. Next slide, please. So we know that changing the system cannot be done alone. On the screen, there are a few of the collaboratives or coalitions that were in there, many others and some in the room. We work through these coalitions, for example, Real Reform for ECD based in South Africa, ECDAN here with us, and the CARE Initiative, which brings together feminist organizations, labor bodies, and ECD organizations, actors who don't traditionally sit in early learning conversations together, but who converge around the care economy. And that reframe is really important. So we go from looking at childcare as a welfare issue to an economic and labor issue. And that's what opens new rooms and new funding opportunities for the ECCE landscape. Next slide, please. Finally, and I'm sure to the relief of the conveners, to conclude, the report calls for systems that are locally owned, government financed, and sustained beyond any single funder's priorities. And that's the direction that we're working toward at Smart Start and the ecosystem in South Africa more broadly. The work isn't linear, but the conditions for universal quality access are becoming more achievable. And with that, I would like to say thank you very much.
Thank you so much, Opalong. And we do need another half an hour just to hear this incredible example of how South Africa, among other things, increasing domestic financing for children's ECCE through innovative approaches, including blended finance instrument. It's a fantastic example. So thank you for that. So with our next two speakers, we are going to transition to looking in particular at regional and global levels effort to support peer-to-peer learning and collaboration across local organizations, which is one of the key recommendations in that report. So it's my real pleasure to introduce Deogracias Yiga, who is the Executive Director of Impacts and Innovation Development Center, IIDC in Uganda, an East Africa-based development management technical assistance organization. DEO is leading a South-to-South peer-to-peer learning initiative across Uganda, Kenya, and Tanzania. DEO, over to you.
Thank you. Thank you very much, Florence, for that kind introduction. It's a great pleasure to be in this space with fabulous people. What I'm going to share about the East African Learning Initiative on Prevention of Violence Against Children is an example that aligns with the broad thrust of today's conversation, illustrating how valuable work can be challenged by transitions in funding and resource provision. The work that we are doing under the Learning Initiative was not being funded by the US government directly, but was being funded by the US-based progressive donor, who more or less at the same time as the USAID wind down, also stopped the funding, but the work continues. So it is an illustration of the importance of trying to sustain valuable work for children amidst a changing landscape. Next slide. Next, please. This learning initiative, the East African Learning Initiative, was started in 2015 by a group of organizations, 7 in number, that were working in the field of violence against children, preventing violence and responding to violence against children. The intention was to improve the quality of programming to ensure that within the limited resources that are always available for child protection, we can have impactful programs on the ground that transform the lives of children and protect them from violence. The learning initiative sought to bring together different organizations working at national level in Uganda, Kenya, and Tanzania to learn from each other, to build on our strengths, to ask ourselves intriguing and critical questions that can enable us to improve the work that we do. And that's what we have been doing over the last 10 years through collective work, collective learning, and collective support to each other. In this initiative, IIDC was the technical assistance partner, and we are supporting the capacity building among partners. Next. The specific interventions that we are providing as IIDC are rotated around: one, impact-oriented program design, supporting our partners to design programs that have the potential to be impactful. Two, measurement, supporting partners to be able to measure the impact of their work or the outcomes from their work and use the evidence from this measurement to improve and innovate and generate even better outcomes. Three, we have been facilitating collective learning across partners, bringing them together to learn from each other on what works, what doesn't work, why what works, and why what doesn't work. We have also been supporting partners, those who have tested and generated evidence on their models and interventions, to adapt them to different contexts and scale them where possible. And lastly, we've been supporting partners to document their work, document their evidence, and share it to broader audiences for greater scaling and adaptation, but also for resource mobilization and sustainability. Next. After 10 years of implementing, or close to 10 years of implementing this work, we decided to do an evaluation of this learning initiative. And this evaluation was spearheaded by Professor Catherine, he's on this call, from University of Edinburgh, and thank him very much. Used the contribution analysis methodology, trying to map the contribution of this learning initiative to the field of violence prevention in East Africa. And the key learnings, major highlights, a lot came out from this evaluation, but the major ones are the ones that I've highlighted here. One, that because of this collaborative approach, there was a shared and deep understanding among different actors in the region on the nature and the complexity of the problem of violence against children, be they governments, NGOs, communities, and children. This deeper understanding enables the design of more holistic and impactful programs because they are based on robust evidence. Two, improve the skills and knowledge among the partners, especially partner staff, partner leaders, and partner actors in the areas of designing, measuring, adapting, and scaling interventions on violence prevention. Three, stronger partnerships between the NGOs participating in the initiative, between these NGOs and their governments at national level, and between these NGOs and their communities where they are working. And four is greater potential for sustaining interventions beyond the project funding, because partners are more confident with their models, there is evidence of efficacy, and there is greater potential to attract resources to support this work. So coincidentally, at the time this evaluation was done, the funding also suddenly ended. And we are moving on. Because of the strong foundation As partners, we are now looking at collective resource mobilization, exploring strategies for sustainability. How can we collectively mobilize resources as a team, not as individual organizations? We are exploring how we can document and disseminate our evidence models to ensure that they can be scaled up by others, adapted and scaled up. We are looking at how we can continue to measure the impact of our work and generate evidence. And we are also focusing on intensified scaling up through working with our respective governments, as well as sustaining our learning, which has been very greatly valued. And lastly, we are having a great focus on how we can leverage technology to deliver some of these interventions at a lower cost through technological innovations. So this is broadly in summary, the learning and the lessons that are emerging from the learning initiative in East Africa. And we are yet to see how we carry these lessons forward. Thank you.
Thank you so much, Dio. This is also a really good illustration of why support to regional learning initiatives is so critical to strengthen collective learning, evidence exchange, but also what I take from it is what you say about ensuring that local organizations control their own learning, and that results in better ownership, but also more sustainable change, as you pointed out. So thank you for this fantastic presentation. So it is now my pleasure to introduce Anju Pun, the Nepal Country Director of Forget Me Not, who is also the co-convener of the Transforming Children's Care Collaborative Working Group on Transitioning Models of Care, a global peer-to-peer learning community of practitioners working at local level to transition models of care to family-based care, and also to influence donors in high-income countries who are driving residential care in their countries and communities. Anju, please, over to you.
Thank you, Florence. And thank you to the Georgetown Collaborative for bringing us together for this important sharing today. Hello and namaste, everyone. It's a pleasure to join you today. I'll briefly share the work of the Transforming Children's Care Collaborative Working Group on Transitioning Residential Care Services. I'm one of the co-convener alongside my wonderful colleagues, Rebecca Knepp from Better Care Network and Christina Kalijas from Changing the Way We Care. So friends, we are not reinventing the wheel, but we focus on sharing practical learning and real initiatives already happening across the countries, even in these complex and challenging contexts. So we are a local peer-to-peer learning group led by practitioners for practitioners engaged in residential care transition efforts at national, regional, and global levels. We are shaping and developing the priorities determined through our work plan process. We are one of the core and foundational groups under the Transforming Children's Care Collaborative, and we are over 200 members right now. Our purpose is to promote and scale good practice in transitioning from residential care to family-based care solutions while strengthening collaboration and shared learning. And we do this in 4 main ways. First, capturing and sharing learning, enabling peer exchange and support, and third, building consensus across agencies. And fourth, important one again, is developing open practical resources for transition, which is available for everybody. Next slide, please. We work closely with the Better Care Network to support global efforts toward family-based care systems. And one key space we offer is the Practitioners Hub. It is an online platform that brings together practical tools, guidance, videos, and resources across the care system. It is also a community of practice where we have co-developed transition framework tools available in English, Spanish, and some in French. Next slide, please. The Transition Working Group has played a key role in building evidence and practical guidance for care transition and has made huge contributions to establish transition as a field of practice with resources available through a central repository. One of the group's outcomes is the transitioning models of care assessment tool developed through peer-to-peer work supported by USAID and changing the way we care. It helps us assess systems, identify gaps, and plan evidence-based transitions. Next slide, please. We also have phases of transition interactive diagram made by the peer members. It visually maps the key stages of the transition process, making it easier to understand the journey from institutions to families. You will be able to see all these tools in the link provided by our colleagues. Next slide, please. Yeah, here we come. So this is the most important part, the financing shift, and all the panelists have been talking about it. So in the context of an increasingly resource-strained sector, the transitioning working group members have identified the development of this tailored funding mechanism as one of the highest priorities of the group and a critical step toward advancing transition practice globally. Therefore, we as a peer learning group are developing an innovative financing mechanism, the Global Transitioning Fund, so that we can scale up the implementation of the transition framework globally. So why it matters? Because more governments are committing to care reform, and we know 5 million children are still growing up in residential care, even though we know that family is the best place for the children's holistic development and well-being. So the goal for us is to scale transition in a structured and sustainable way, and the impact is significant. This approach will accelerate children's reintegration into families and redirect resources towards strengthening families and community-based care. This is why transition is very urgent for us. It is about what we choose to finance. And the goal remains simple. Every child deserves to grow up in a safe and loving family. Thank you for listening to me.
Thank you, Anju, for this amazing presentation, reflecting really powerfully how global networks and collaborative platforms can play a role in supporting local practitioners to come together and learn from one another and develop common tools, good practices to inform the practice and the policies to support children and families. Thank you so much. So, colleagues, we've gone through a lot, but last but not least on our panel, it's my pleasure to introduce Peter McDermott, an internationally recognized expert in global health, child protection, and care and development, who is a member of HDPI, the Humanitarian Development Partnerships, a global network that's facilitating dialogues to elevate child protection and care within the broader foreign aid infrastructure. Pete, please, handing over to you.
Thanks, Florence. And can I also congratulate the prior speakers for very, very quick summaries of some really important work. It's a pleasure to be here today, everyone. And I'm representing some colleagues who are also with me from the Humanitarian Development Partnership Initiative and the Child Protection Reference Group that sits within that. I'm briefly going to speak to 3 points this afternoon. First, some introductory comments. Secondly, what the Learning and Action Initiative is. And thirdly, some insights that we've gained under phase 1 that perhaps we could coalesce with as joint initiatives going forward. First of all, thanks to the Georgetown Collaborative Group. I'd really like to echo Hanny's comments from earlier, really your dedication, resilience, and your innovation in what you're putting on today after what has been a traumatic year for you and colleagues like myself that have had the pleasure and gift of working for USAID. It's been a traumatic time. I really would like to congratulate you also on the 2 seminal publications that are the backstops for this meeting. I think they really take us a long way, and the meeting itself is a real, I think, testimony to the collaborative spirit, both for us today, but also with HDPI, who I know we're trying to strengthen our work together. Secondly, an overview of the Joint Learning Initiative. HDPI is what I call a TAT, T-A-A-T. a new acronym I very proudly made up this morning, but it's really a think action tank, a think and action tank. And the idea is really that it's a non-affiliated platform. It brings together a very diverse group of people from across many sectors, especially children, child protection, care, emergencies, humanitarian work, human rights. But really, the Joint Learning Initiative is a proven methodology. Many of you familiar with Jim Kim, Paul Farmer, Lincoln Chen, and we used it extensively during the AIDS crisis for children 20 years ago to put the face of children on that epidemic and the surrounding situation for children. The goal and purpose and the methodologies I've outlined in the slides, so we can jump to those. I'm not going to talk to the slides per se. And one of the slides at the end is really about HDPI, so I won't go into further details about that. But I will substantively, I think, look now at really part 3 about what are we trying to do and why, what are we hearing. Under phase 3, we consulted, as did our colleagues from Columbia's Global Initiative for Children, extensively at global and regional level, and had 30 CSO respondents in meetings with us. And it's quite clear, as you can see from the substantive slide, which is go down to, if I may, Florence. I'm not going to summarize the substantive slide, because what I want to try and do really is to pull out from that some of the direction that we're using to frame now our phase 2. And that is that, yes, we recognize the crisis and the importance, the funding and the challenges to institutions in their survival and downsizing. But in many ways, the crisis has exacerbated some underlying structural problems, both within child protection, within childcare, and between childcare and protection, and also how child protection and care in the wider child ecosystem. But notwithstanding the challenges, I think there's also an opportunity. And HDPI is deliberately taking a step back and not trying to address just the here and now, but more importantly, look forward and say, how can we envision a more effective global response echoed at national level for the protection and care of children? And this goes way beyond just some of the issues about funding, and it really starts to look at some of the underlying political economy issues. And the first one I think that comes from is the issue that has been echoed again, I think, by every speaker today, is around the need to transform and shift power. Mike Wessel's book on community child protection, I think, exemplifies this need, and also about how it can work in Kenya, India, and Sierra Leone. I think the issue really is not the what there, but the how. And how can we do this? And how can we reuse international assistance, financial and technical, to genuinely move beyond the rhetoric of localization to the reality and the realization of national ownership, both at the government level, at the community level, CSO level, but more importantly as well, perhaps as the family. And that brings me on to the second point. The issue for families and communities is that everybody gives them due recognition, but often they're not part of any formal system, and yet they are the first responders. More children are looked after by families and extended families and through kinship care models than ever in any other form. And yet they're often not recognized, under-resourced, under-capacitated, and the methodologies, I think, are beginning to develop. Having just come back to review the India child protection new community protection, I'm really encouraged by how some of these new models are developing. But we have to get beyond the idea that we all bow and genuflect and nod to national ownership and then bristle when really they try to manage and direct us and make sure that we come in between the pans. Similarly, we won't ever stop the threats to children unless we can do much more on using and supporting families to take ownership with their communities to child protection as the first responders on prevention and not just on response. And I think that there is a need to recognize and formalize the paramountcy of family care, family strengthening, and family child protection and community. I think the third area that's coming out very clearly that we, again, struggle with and have struggled with as a community for over 30 years is how do we provide comprehensive wraparound services for children and not fragment the services, whether that's health, education. I think our ECD colleagues have been very good on what they've tried to do, and there's a model there. But intersectorality has to go beyond just nominal coordination, collaboration, and coherence, and have effective implementation mechanisms at the sharp end with families, that we're not providing siloed service provision. I think the next area that is coming out clearly is that we talk to each other in a technical language, and we need to reframe the perception and reframe the narrative around some of how we speak about and what it is. And this again comes back to the political economy issue. We will not have fiscal space, we will not fiscal transition unless we can make a more convincing case publicly and globally to how children should fit in to a public responsibility of a funded and supported and higher profiled child protection and care system. I also think that the strategic collaboration.
Sorry, I don't mean to interrupt you, but just to wrap up, because we're running out of time for our panel.
And my last point is really around some of these areas, whether it's the prevention agenda, whether it's the learning agenda, whether it's some of the transition to national ownership, really should become areas of strategic collaboration amongst us and complementary initiatives. Thanks, Florence.
Thanks, Pete. And again, apologies. This is really important and rich learning that HDPI is doing. And it's really great to see how you're helping the community, care and protection community, to reimagine how they're doing care and protection and development, but also looking at how governments and countries are already responding and adapting to that changing landscape. So really, I encourage everybody to look at the learning that HDPI is doing and engage with it as well. So I would like, with no further ado, to thank, first of all the amazing panelists who've had to share with us some incredible intervention, learning, all of this within a very condensed period of time, and they've done an amazing job. And now we can actually move to the Q&A, where you can ask questions and we can deepen some of that. But we would also really encourage you to reach out to these amazing actors, and also connect to the links to their resources and their organization. So I'm handing over right now moderation, with many thanks to Katie Murphy and Jody, to facilitate the Q&A. Thank you.
Thank you so much, Florence, and thank you to all of the presenters. Excellent, excellent presentations. You condensed so much in such a short period of time, and it's so inspiring to see these practical examples of innovative ways that the national, regional, and global champions for children are responding to the moment and building more resilient and sustainable systems. So commend all of these efforts, and really looking forward to this discussion. Please do put your questions in the chat. Or in the Q&A function, and we will be monitoring them and bringing them out during this portion of the discussion. Together with Jody, who opened our webinar today, we'll be transitioning to this Q&A portion, and we really want to think through how we can build upon these practical examples and recommendations for our collective efforts to ensure that we are not duplicating but supporting each other. As mentioned, I am representing the Moving Minds Alliance as the interim director. For those of you who are not familiar, the Moving Minds Alliance is a multi-stakeholder global alliance focused on elevating the holistic needs of young children affected by crisis and conflict. So by pushing for stronger policy commitments, improved financing, and recognition that early childhood development is a critical component of any crisis response. Carlos's presentation highlighted some of the focused efforts we're doing in supporting national level coalitions, conducting analyses of domestic financing and barriers and opportunities, bringing together actors across government, civil society, and private sector, and really importantly, ensuring that those directly affected by crisis have a voice at the table where decisions are made. So right now we have 3 priority countries, Colombia, Nigeria, and Syria, bringing the local to the global and using the lessons learned from these experiences for other crisis contexts. So we're also supporting knowledge dissemination through local researchers and journalists. Invite you to learn more on our website. But with that, we will transition to the Q&A. We also have a Mentimeter that you can see in Kat has just put in the chat. And this is really to look at where we're seeing trends in our collective efforts and what's happening at the local and regional and global level, and so that we can then think through together how we can support collective action moving forward. So with that, I will go to our first question that we have for Dio. Dio, could you please give us an example of how the work done through the East Africa Learning Initiative has supported actors in one of the 3 countries to actually change or adapt their approaches in responses to violence against children?
Thank you very much, Kati. Yeah, there could be many examples, but I'll pick one. One of our partners in Kenya, investing in children and their societies, ICS, came into the learning initiative with a program, a parenting program, positive parenting program. And this program was refined and curated through this learning initiative over the years. But in the learning initiative, we also brought in government. Wherever we convene, we bring government actors to interface with the members of the learning initiative. And over time, the government of Kenya decided that they were going to run a national parenting program. And because of this engagement, and because there was already a program that was tested, evidenced, refined, and well documented, the parenting program of investing children and their societies, ICS Africa, was adapted by the government of Kenya and is now being rolled out nationally as the government, with minimum modifications, as the government parenting program. And this illustrates the opportunities that exist for building stronger partnerships based on refined programming and strong evidence working with the government.
Excellent. Thank you so much. I'll now pass to Jody for the next question.
Thank you so much, Katie. So there was a question in the chat that seemed to be quite a general question about how can I get involved in the work. So I think I would like to direct that to Matito, who can perhaps mention the survey, because I know in the survey there is an opportunity for people to provide information on who they would like to follow, who on the panel they would like to follow up with. Matito, if you could maybe speak to that.
Absolutely. So, part of what we're doing with this work is really looking at this collective impact and how do we move forward together, and how can Georgetown University and all of these amazing global regional networks support that collective movement. So in addition to the Mentimeter, we'll be putting up a Google survey at the end. Put your name on the list. Tell us how you want to be engaged. After that, Sev, Kat, and I are going to kind of come together and figure out our next steps moving forward, if we see there is interest and if we see there is momentum.
Thanks, Matito. Katie, back to you.
Great. This is a related question, but I think Mohammed has asked in the Q&A around what role should local actors and governments play in sustaining child protection and care systems when external funding declines, and how can the international alliances better support local leadership without creating dependency? So I don't know who would like to take that, maybe Rebecca or... Oh, sorry. Matito?
Sorry, Katie, I can take it. I was working behind the scenes on the Mentimeter, so can you repeat the question?
Oh, sorry. It's in the Q&A box. So it's related to the last question, but what role should local actors and governments play in sustaining child protection and care systems when external funding declines? And how can international alliances better support local leadership without creating dependency?
Yeah, I think there's a huge role on local leadership to really hold governments accountable and advocate for the children and vulnerable populations on the ground. Often, as we work with children, we know that they don't have agency, they don't have voice, they often don't vote, they don't have money. So we need individuals to really make sure that that's being brought forward to governments to support them. I think, as Rebecca said earlier, a lot of leadership doesn't think about children immediately for the reason that they don't vote, they don't have money, they don't have things that they can contribute immediately to community. So we really need that voice, and we think that the local leadership understands the situation and can really come up with the right solutions for those populations. So I think, working through the networks in terms of staying on top of the most recent evidence, as well as really bringing that collective impact, we can be a voice for children, we can increase capacity, and really hold governments accountable, and international agencies the ones that remain accountable for the work that's happening on the ground.
Great. And Hapalong, is there anything that you would like to add to that, or any of the other panelists?
Yeah, I think it touches on what we chatted about in the South African context around domestic financing in some instances. And for our context, ECCE provisioning in particularly low-income communities is designing models that work in those low resource informal setting because of the strong belief that quality lives there, but in terms of sustainability as well. But I do think Matito covered it, but I would say, again, amplify the domestic financing component of things and integrating that into government systems to lessen the burden or to lessen disappointment, I guess, on donor funding and the risks on donor funding. Not that, yeah, it doesn't come without risks from government side either.
Great. Excellent. Do any of the other panelists want to add to that?
Yes.
Yes.
Yeah. I think with the diminishing resources, shifts are critical. With the diminishing resources, and as we explore alternative sources of funding, the issue of efficiency and value for money is becoming a lot more critical. So as civil society, as innovators in the field, we have to ensure that our programs are actually impactful and there is evidence that they are impactful. Because now we can go to private investors. If you're going to private investor, you need to have evidence that what you are investing in actually is transformative, is value for money. Even governments are beginning to embrace this. The governments, especially in Africa, that are beginning to invest are asking tough questions. They want evidence, which is good because they want evidence that what you want them to invest in actually works, because they don't have a lot of resources and they want the maximum returns for those resources. So for us, it's actually efficiencies, building efficiencies and ensuring we have evidence for our work that it is impactful. I think it increases the prospect for attracting resources and sustaining the work.
Excellent. Great. So it looks like we're now transitioning to the live results of the Mentimeter.
If you want to take one more question, I'm happy to, and then I'm just putting it up because the QR code is up there, and just to remind people, and then we can do some of the reveals. So maybe one more question, Katie. I think maybe Anju has a question
Sure. Jody, do you want to ask that question for Anju?
Sure, Anju, there's one for you. It's about the Global Transition Fund. The question is, can you please explain in more detail the Global Transition Fund? Who are the funders behind it? Does it have priority countries, and who can access it?
Thank you for the question. And apologies, electricity has just gone. It's heavy rain in Kathmandu. So I would try to respond to your question. The Global Transition Fund, we are still working on it. And the priority for us is the members of the working group. And we are local from local countries where the governments are committing to care reform and invest on the transition. So right now, this is the priority for us. And we have developed a concept note where we have technical review panels and the criteria who can apply. And the most important thing is, as I said, the governments in the countries where care reform is one of their priorities, that is where we will be calling the expression of interest. But it is still on the developing phase. Thank you.
So, Katie and Jody, if it's okay, I'm going to go and show the first results in terms of where we're seeing momentum and action among the recommendations by any actor. A little bit kind of higher on shifting power and resources to local actors, not kind of the same around the following five. If we look at the next slide, we're really seeing, again, some momentum coming out on sustaining and streamlining regional and global stakeholders and improving efficiencies and reducing costs. I think we would love to hear a lot more about how agencies and organizations are really reducing some of those costs and efficiencies and where we've seen some of that work. I think there's a lot of really good global learning. I'm going to move to the next slide, which is really going to show this is a ranking on where people see the highest priorities. And I don't know, Katie or Jody, you want me to turn this over just to kind of talk through a couple of these, or you want me to keep chattering away here?
I'm happy for you to, if you'd like.
I think this is really telling. I think the priorities are around really strengthening that local, inclusive, multi-sectoral systems, and that's where this group is really seeing the need moving forward. That coordination mechanism from national to community levels is the second priority among the recommendations. So really it reinforces that emphasis that we talked about in the recommendations report about going local and really pulling from that local expertise. Shifting that power to local actors and really, empowering and resourcing civil society and lived experience. Unfortunately, I think we are at time. Correct me if I'm wrong, Jody, Katie, and let us go ahead and thank the panelists. The questions, there's no way we're going to answer all the questions today. If you look in the chat box, we're going to be putting a survey in there. You can ask more questions. We can do some follow-up with you, how you want to be engaged. But Katie and Jody, do you want to turn it over to Sev and Brett for wrap up?
Great. Yeah, well, thank you so much, everyone. It's been a pleasure to be part of this really exciting event. And thank you so much to the Georgetown folks who have done tremendous amount of work revitalizing the great brain trust and efforts of USAID and ensuring that we're continuing to work in collaboration. And so thank you all so much. Yeah, questions, please keep them coming. This is intended to be the start of a conversation that we will carry forward, building upon these helpful insights that you've shared with us here today. Thank you. Jody, do you want to say anything before we hand to Brett?
No, just to echo your words, thank you so much to everyone that has presented today, to really what is really a lot of information. You've condensed it into a short period of time, and I hope that we can have more events like this in the future, with everyone on the school. And thank you very much to the co-conveners. I think I'm handing over to Sev and Brett for the closing.
Wonderful. Thank you so much. I will just highlight, we will post a link in the chat for all of you to highlight if you want to engage, pass on your information and any additional recommendation of what we should prioritize for collective action and how we could do it. So it's amazing to see already so many examples and thoughts here. Thank you again. And please keep them coming. We will summarize those and discuss how we can move some of these forward with all our co-conveners today and the broader community. So many, many thanks. And over to you, Brett.
Thank you, Seb. I'm Brett Weissel with the Early Childhood Development Action Network. And I know we're a bit pressed for time, so I'll just be brief as we wrap up. But first, let me just say thank you to our speakers. This was amazing. And thank you to Georgetown University for hosting the webinar and launching this very important report. It was a great webinar. And it was really great to see so much discussion around concepts like networks and systems. So I'm grateful for that. So briefly, just to conclude with 3 key points. First, it's time to build back better. Hopefully the system shock that is now past us, and we can think about what we need to do to move forward, highlighting a locally led approach, and using the lessons learned that we talked about today. But we have to start now, and we need to think about both the short-term and long-term approaches. Second, I would just encourage us to, the discussion really reminded us that no one single organization can solve these issues alone, all right? And in times of crisis and in times of rebuilding, we can either choose to look inwardly at protecting ourselves, or we look outwardly at the greater good. And so I encourage us all to look outwardly and to think about what are those new partnerships that need to emerge, that are going to demonstrate and reinforce the cross-sectoral nature of ensuring that every child can thrive. And then finally, given my work in advocacy, I think I'd be remiss not to highlight the importance of using our voices, using them strategically, systematically, and urgently. We heard today about shifting power and refocusing on domestic financing and these important concepts that require advocacy. We will not achieve what we discussed today without it. And that means we need to make investments in terms of resource allocation and capacity strengthening so we can build that political will that we need and mobilize the demand that is necessary to achieve the recommendations that were laid out in the report and on today's webinar. And so for ultimately long-term change, we need to support the movement, not just interventions. With that, just again, a sincere thanks to all of the panelists today, for Georgetown University and for hosting us. Please do read the report. You've seen it in the chat. It will be shared with you as well. There are some important takeaways from that work. And so with that, I bid you all farewell and thank you for joining us today.